Alrighty, folks, welcome to another edition of the Healthy Way right here on Love 101, the family station. Today we're talking about C-sections by maternal request, cesarean delivery and maternal request, right? Now, the incidence of cesarean delivery and maternal request and its contribution to the overall increase in the cesarean delivery rate are not well known, but it is estimated that 2.5% of all births in the United States are cesarean delivery on maternal request. Well, we're talking about all of that and so much more this morning. With us is Dr. Leo Walker, obstetrician and gynecologist from the Westminster Medical Center. Hey, Dr. Walker, how are you?
Hi, morning. I'm great. Sorry.
Nice. Good to have you. Well, this one is heavy, so I'm going to ask you to give us an overview of what we're talking about.
So when we refer to C-section by maternal request, it simply refers to cesarean delivery or C-section, really only performed because the mother requests it. And this is usually in the absence of standard obstetric or medical reasons for avoiding a vaginal delivery, like, so for example, if the baby is very large or if the baby is in the breech position. So simply, the indication is quite simple because the mother requests that route of delivery.
And if she doesn't, then you go the other route.
Right, certainly. So once there are no contraindications for vaginal delivery, we often go with routine vaginal delivery. But we do have, patients who, for one reason or another, may request a cesarean section. And it's always something that we're encouraged to explore in terms of what's the reason behind a patient would want a cesarean section, because there do exist quite legitimate reasons as to why a patient may want to avoid a vaginal delivery and have a C-section. There are patients who may have had very traumatic prior labor experiences and don't really want to go through that again. There's sometimes patients who have the fear of the pain associated with labor, patients who sustain very significant vaginal lacerations in their past vaginal delivery, and again, seeks to avoid certain things like that. And it may be something as simple as a patient feeling a little bit more, or it be more convenient to have a scheduled delivery. So the reasons are numerous, and it's always something that we're encouraged to explore and not simply dismiss or encourage without actually finding out, well, what's the reasons I want to go down this road.
And when a woman desires a cesarean delivery, what are some of the things you consider? Talking about some risk factors, I gather age could be one.
Right, certainly. Yeah. So maternal age, especially patients who are greater than 40 years of age, simply because risk during vaginal birth tends to increase as maternal age increases. This is because chronic illnesses tend to also increase with age, things like diabetes, hypertension, increased risk of stillbirth, increased risk of labor dystocia. So there are a lot of people who may routinely perform cesarean deliveries for individuals of age greater than 40, for example. But certainly cesarean sections aren't without risk, and there's always something that we have to explain to patients beforehand to provide them with appropriate context so they can make an informed decision. With C-sections, there's the increased risk of blood loss at the time of delivery. There's a prolonged hospital stay, increased recovery time, so increased time spent in hospital, as well as increased risk of injury to some of these surrounding structures within the abdominal cavities. We're talking about the bladder, bowel. So all of these things are things that patients have to be made aware of prior to making that decision and going forward, to be aware that, listen, these are the pros, these are the cons, and this is how we're going to address some of these things. Talking about my maternal request is ultimately the patient.
Are there benefits, Dr. Walker?
I mean, certainly. So the risk of what we refer to as perinatal asphyxia, meaning the risk that baby will have decreased oxygenation during the time of labor, is significantly decreased with a C-section. With a vaginal delivery, that risk of perinatal asphyxia is around 1%. Risk at the time of C-section is around 0.2 to 0.5%. So we're talking about, more than half we're reducing that risk by. So that is one significant advantage of the C-section, as well as delivery can be scheduled, delivery can be timed, and of course, risk of blood loss is significantly decreased when we're talking about an elective C-section, meaning one that is done at a particular time on a particular date, versus a patient who is allowed to labor with the view of having a vaginal delivery. Complications arise, and then we need to convert to an emergency cesarean section, which will inherently have more risk.
I was reading last night, and this article I saw says in the absence of other indications for early delivery, cesarean delivery on maternal request should not be performed before the age of 39 weeks.
Right, precisely. So you would find that majority of the time, whether or not we're scheduling a vaginal delivery or C-section, that we do it prior to 39 weeks. 39 weeks is referred to as what we call the beginning of full term. So traditionally, we know term to begin at 37 weeks. But that is really what we call early term. And with early term comes some small risk of the baby having some of those problems associated with prematurity or preterm birth. Risk is quite minute, around 2%. However, at full term, that risk significantly decreases to around 0.1 to 1%. So we often prefer delivering babies, if it's something that has to be done in a scheduled fashion, at 39 weeks, because that is now full term. So most of the times when we're talking about scheduled deliveries, whether or not it's vaginal or C-section, it's done at 39 weeks. So again, when patients are requesting a cesarean section, those are one of the things. This is one of the things that we tell them. That listen, if it's an issue you want to schedule for convenience, it should not be done prior to when you're at 39 weeks.
All right. What else you want to share? Because I know we have a whole lot. So tell us, talk to us.
Well, definitely, C-section, it shouldn't be something that is shied away from. Mothers have the right to request cesarean section, but we as doctors also have to be able to provide them with the necessary information so that they can make informed decisions.
Right.
Now, that doesn't mean that cesarean deliveries are better than vaginal birth. Each has their place and each has significant benefits, but also significant risk. And it's important to have that conversation with patients so they're able to have all the information before making their decisions.
All right. So we're talking about cesarean delivery and maternal request with Dr. Walker. Is that where we're leaving it today, Dr. Walker?
Yeah, I think for now, I think that's enough to digest.
Yeah. It's heavy, I did say. How can we find you again, my friend?
I'm at the West Minister Medical Center, that's 1 West Minister Road. You can also find me on Instagram at Dr. Leo Walker and contact me at 876-372-3790.
Appreciate it. Keep safe. Keep up the good work.
Yeah, man. Same to you.
Great. Dr. Leo Walker there, obstetrician and gynecologist on the Westminster Medical Center. Yes, cesarean delivery and maternal request. Yeah, it's a heavy topic, and some other time we'll pick it up again and talk some more. Big thanks to Dr. Leo Walker. This is Love 101. It is the family station.